Assalamualaikum, Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower arch for implant placement. The CBCT was taken while the denture was on, so you can see metal artifact there. Now moving to the transaxial view. The transaxial view is basically the proximal view. Here we will be able to show our doctor how the ridge looks. The anterior part of the ridge is D1 quality of the bone. You can see that there's all cortical plate. There's no cancellous bone. So implant placement here should be kept in mind that if the bone during the bone drilling the bone is not bleeding at all, so implant placement should be avoided. But we do see areas of some vascularity, which is why we have placed virtual implant. So the ridge width in this region is approximately 5 millimeters of width with a good 12 millimeters of height. In the lateral region, we've got a good 5 to 6 millimeters of width with a good 12 millimeters of height. In the canine region, we've got very thin ridge, so we will not advise placement of implant here. But in the first premolar region, we've got some good bone, and we've got 4.7 millimeters of width with a good 12 millimeters of height. Just distant to the ventral foramen, we've got very good cancellous bone. This is now D2 quality, and we've got 5 millimeters of width with 12.5 millimeters of height. In the region of 6, the ridge gets a little narrow, but we've got 6 millimeters of height with 10 millimeters of 6 millimeters of width with 10 millimeters of height. Now moving to the lower left molar region, here the ridge quality is very good. We've got D2 bone quality with good cancellous bone, 7 millimeters of width with 11 millimeters of height, and here we have got a shorter ridge here. We've got a good wide 11 millimeters of ridge width with 8 millimeters of ridge height. Now we've shown you all the measurements. We will now take you to the implant placement, and there we go. These are all the implants we placed. The yellow implants are 3.2 in their diameter and 10 in their length, whereas the green is 4.6 and yellow is 3.8. These all will be sent to you in a detailed report, but these are the ideal implant placement positions according to the prosthetic guide available. And if there are further questions, please feel free to reach to our team. We would be extremely happy to help. This is how it looks on the axial view. All implants placed are in the center of the ridge with the correct angulation. Thank you very much.